Now, is it safe for you to exercise during pregnancy? Yes, it is. But there are some guidelines that you really need to be aware of. Now, the first and most important thing is that it's really important for you to check with your GP or your midwife before you start doing an exercise program. So if you've already seen them during your pregnancy, it's very likely that you will have been able to ascertain whether you have any conditions that are actually not conducive to exercising. So basically, if you have one of these conditions, your GP or your midwife would have said you cannot exercise. Now, if you're at all unsure, go back to them and double check that you don't have any of those conditions and that it is safe for you to exercise. That's your first thing. The next thing you need to do is you need to make sure that the environment that you're in is conducive to you exercising. That means it needs to be well ventilated. Your body temperature, your core body temperature, gets a lot higher in pregnancy. And it's really important that you don't allow it to get too high. So that just means being in a well-ventilated room. You might need to open a window. You might need to have accessibility to air conditioning. It needs to have air circulation through the room. That's really important. So have windows, have something that you can open, or some kind of ventilation system. You also need to make sure that the clothing you're wearing is really comfortable. If you need to take layers off, that you can take those layers off, so again, that you don't overheat. It needs to be comfortable to exercise in. Now, during our classes, we have bare feet during the class, and this is really important because we're working on strengthening the feet, and we need to have them bare. And any of the movements that we do in the classes, there's no reason or need to have shoes on. However, if you are exercising outside, if you're exercising in a gym or in other types of environments, you need to make sure you've got a suitable pair of trainers or exercise shoes that you can safely exercise in. If you're exercising in a pool and you're doing exercises, i.e. using the bottom of the pool, again, it's really important to have something that enables you to have some kind of grip that you can't actually slip on. So do think about that as well. You also want to make sure that you've got a really good sports bra on or some kind of fitted bra that's going to support you during your exercise. That's really important. It needs to be comfortable as well and doesn't irritate or itch or anything like that. So make sure it feels really nice and comfortable. Now, you've got to have water. You've got to drink water before, during, and after your exercise. So always make sure you've got that water bottle. And it's really important, particularly in pregnancy. It's important in other aspects as well. But for pregnancy, when you've eaten, and the timing of your eating is really important. Now, if you've had a meal about 2 hours before, then you may be okay and you may not need to eat anything directly before your exercise. But if your last meal was longer than 2 hours, then it's really important you have some kind of snack before, or you've got a snack handy like a banana. You could have a glass of orange juice, you could have a smoothie, or some kind of energy bar before you start your exercise, or just have something with you, on you all the time. Often in pregnancy we need to carry something with us anyway to make sure that we can keep our blood sugar levels up, but even more important during your exercise. So just make sure that you have eaten within 2 hours or you've got some kind of snack. You also want to make sure that when you're exercising, you are listening to your body. This is really, really important. Now, you never sacrifice sleep for exercise. If you are feeling overtired, really, really tired, do you know what? I don't want you to do your exercise class. I want you to sleep first. And that's really important because if you are overtired, overfatigued, then you can make mistakes. And your sleep during pregnancy is so important for you and your growing baby. So don't sacrifice your sleep. Now, during your exercise, whilst you exercise, you need to listen to your body. This is so important. So if you feel any aches or pains, stop what you're doing, readjust, follow what we're saying in the classes, and make sure that you can continue pain-free. If your pain continues, stop again. It might be that you need to completely stop and just stop for that particular session and get some extra help. Now, if it feels really mild, it might be that you can follow one of our videos. So click on the video that was specific to that exercise and follow the masterclass video that tells you how to do that piece of exercise absolutely spot on. And it might be that you can then continue with the exercise. If the pain is continuing though and you've stopped exercising, you need to really question why that pain is there. And this is when you really need to go and get some other external help. So you go back to your midwife or your GP and you double check why it is that you've got that pain. Listen to your body always. And the rule of thumb is if you're at all unsure, stop, go and get some expert help. Now, there are certain things that you really must listen to. So if you're exercising, if any of these things happen, you stop straight away and you get medical help. Okay, that's medical help. So if you feel dizzy or you're fainting, you stop. If you feel extreme shortness of breath that you just can't recover from, you stop, you get expert help. If you get any vaginal bleeding, you stop. If you get any sudden water discharge, you stop. Any signs of labor, you stop exercising, you get expert help. If you get extreme headaches, now headaches can be very general, and it might be that you just need to drink more water, but if you get a headache that's really unexplained and it continues, you need to go and get some medical help. If you notice decreased fetal movement, then you need to stop exercising and get some help. If you get any chest pains, then you need to stop and get expert medical attention and help. If you get any calf pain or swelling, then you need to stop and again get medical expert help. So I hope that's really clear. And if you listen to all of those things, then you can carry on through this exercise program. And don't forget, I'll be reminding you of all these things through the classes and helping you with all of this as we go along. And also remember that the forum is there that you can ask questions all the time. So if you get an ache or pain and you're not sure whether you should be carrying on or not, you can always ask those questions. But the rule of thumb is listen to your body and get expert help if you really are unsure. I hope you enjoyed the video, and if you did enjoy it, and for us to be able to make even more content for you, I'd really appreciate it. I'd love it, in fact, if you could subscribe and like the video, and obviously if you want to make any comments as well, because any comments you make, we will be able to act on that and produce more material that you like.